Hey, folks, if you want early access to episodes as they drop, click that subscribe button, join us, and together we'll fix the broken U.S. healthcare system. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host, and I am here with the lovely Lexie Leitner from River Health.
Good afternoon.
Did I get that right, Lexie?
You sure did.
Right on. I always mess that up. I always butcher names. Don't ask me why. Maybe it's the excitement of being here. You know.
I mean, I'm very excited, so I can see why. But thank you for having me.
Excellent.
Excited to be here.
It's my pleasure. Thanks for joining us. So tell us a little bit. We're obviously going to get into River Health, which I'm excited about because it's not your grandfather's health plan or even your dad's health plan.
It surely is not.
So we're going to get into that, but I'd love to learn a little bit more about you because as I understand it, rumor has it that you are a PA, otherwise known as a physician's assistant. So tell me about that journey. Take us back.
Okay.
Where did this all start?
Yes. Well, science nerd at my heart, right? So grew up loving all of the volcanoes you were building in your basement. Loved the science part. Actually went to college thinking I was going to be a biology teacher because I wanted to share that love of science. Went to college at the Winona State University in southern Minnesota and took the first year of science classes, loved it. Then they told me I had to start taking classes around like classroom management and when to give out hall passes, and that was a no for me. So started looking at other ways to share my passion around science and also my passion around helping people, and found my way to physician assistant studies at Augsburg College in Minneapolis.
Right on, in Minneapolis. Yeah. Ooh. There are some pretty big health systems in Minneapolis.
There are quite a few. The trade organization Medical Alley is there because there's so many different, healthcare startups, healthcare companies, health systems. Yeah, so
home of United Healthcare, biggest.
It is the home of
giant
United Healthcare. Yeah.
All right. So as we were saying, you were schooled in Minneapolis?
Yes, sir.
What was Minneapolis like? I'm a kid from Queens. New York City. It's kind of suburban, but also very metropolitan. It's a big city, right?
Yeah.
But there we have access to Long Island. We're on Long Island. Technically, Queens and Brooklyn are part of Long Island, folks, whether you know it or not. And so when I travel to the Midwest or across the country, I'm always interested in seeing how other people live because we're all living in our own little worlds, right?
We sure are.
You're not from Minnesota originally. Where'd you grow up?
I am. I grew up actually in St. Paul.
What?
Yes, and referred to as St. Small, right? So it's part of the Twin Cities, but the smaller of the two, and certainly still has a lot of that small town feel. And kind of similar to New York, right? We, they're not called boroughs, right? We have our own little cities within cities.
Yeah.
So I grew up in Frogtown, was the city within a city of St. Paul where I grew up.
Okay.
And my the daughter of a librarian, and then my dad has owned a bar since I was 3 years old. So
right on.
Small corner bar, and so it actually has some very similar New York vibes in that you go out your front door, you walk your couple blocks, you're at Dad's bar, and
wow.
So very very small homey feel. And Minneapolis being a little bit larger. Maybe is that other side of the river feel, just like it is, here. You get over to the big city.
So my aunt, my mom's sister, was in the bar business.
Okay.
So my Uncle Ed was a World War II vet, and he came back from the war, and a bunch of years passed, and I guess he settled in. But he's like, oh, let's go buy a gin mill. So they buy this bar. Ida's Folly, last stop of the Oyster Bay line on Long Island Railroad. And they had a big clientele of conductors and locals and stuff like that. But I kind of grew up in that environment on the summers and stuff like that. Is my dog attacking you?
No.
Okay, good.
Nope, we're good.
We'll show you him later, folks. He's a terror. So anyway, I kind of grew up in that environment. And It's an education growing up around a bar.
It absolutely
Would you say?
is. Yeah. So my dad is actually a Vietnam vet.
Oh, wow. Thank him for his service.
I absolutely will. Yeah. So when he came back, was, tried a couple of different professions on to try to figure out what his niche was going to be. And he too fell into, I'll sling gin and, make my living while also hanging out with my friends. But it absolutely is an education. And certainly I credit the folks, our patrons, for helping put me through school, which I'll always appreciate. But you learn a lot about the human condition.
You learn a lot about people.
How to ask good questions and how to talk to people. And I think that's, been really helpful for...
Well, alcohol has a way of letting people open up.
Absolutely. It sure does.
Right? And so you were just a kid, I'm sure, right? I don't know if this was...
I worked... we still own it to this day.
To this day.
Yeah, so I have spent many a shift
at
Billy's Victoria.
But it's funny because when you grow up in that environment, when you're around that environment, I was as a kid... the patrons will talk to you like you're an adult.
Yeah, they sure will. Yes.
You learn a lot. Mm-hmm. You learn a lot. That's so cool. And so, okay, so let's get off of that. And the PA path is not quite as exhaustive and there's not nearly as much involved in that path as it would be if you signed out to be an MD, right?
Absolutely.
It's kind of a shortcut, but you get a lot of the perks that go along with being an MD without being an MD.
All true. All true statements.
Yeah. So my wife's first cousin, Charlie, who I've had on as a guest, is a PA, and one of the smartest guys I know. And I think, he basically just said, like, excuse me, I just couldn't see myself in that much school. And then the residency, et cetera, it's like a 14-year commitment, right? It's not like there's no shortcut.
There is not. And I think if you want to be a neurosurgeon or a cardiologist or a lot of these jobs, like you have to be doing that. But I knew that I wanted to do family medicine. Yeah. I knew that I could do that by being a PA and get there a little faster.
Very cool.
So, yeah.
So what excited you about it? What do you think drew you to it? Was there any moment that you can look back on and say, that's when I knew? Yeah.
I mean, I think it was that Venn diagram of putting your interests and your skills and abilities together. When I decided I was not going to be the biology teacher, I did go to career services and took like the 350 question test where they're like, what would you be good at? What would you be good at? And apparently I would have been good as a baker, which every person in my family would disagree with. But the interest survey said I'd be good at that. I would be good at actuarial sciences and or a career as a physician. And same thing, took an inventory of what the physician life would be and actually did apply to medical school and got into a couple, but decided, for ultimately balancing, even then knowing I wanted some work-life balance.
Yeah. Can we agree that those tests are bullshit?
I mean, they must be if they thought I'd be a good baker.
Right.
But...
I mean, how can you figure that out? Like, I think there's feel that can't be measured on a test to determine whether or not you'd be a good baker or a chef.
I would assume so.
That's crazy. So you so now you're going down this path, and what's the workload like? What is your life balance like? Is it like morning, noon, night, eating, breathing, sleeping, medicine?
Well, I think that's really evolved in the 20 plus years I've been doing this, right? In family medicine, it was, 9 hours of seeing patients and then usually another hour or two charting before or after the work day. But certainly loved it. It was amazing. And I learned a ton and made great relationships with providers and patients alike, which was lovely. But then, for almost the last 15 years, I've been, in clinical operations, which is an entirely different type of work-life balance beasting,
right.
in order to do my job.
So in your last 15 years, describe what that role now is, because I'm not exactly familiar with that term, and I'm sure most of our audience is not. So what does that mean?
Yeah. So in clinical operations, I take my expertise as a physician assistant, but also all of the the knowledge you get just working in a clinic, right, about how things like pharma works and how other facets of care delivery work. And then I use that in order to, build people, processes, and systems, or operations, as we call it, in order to deliver that care. So I'd been practicing in family medicine out in Elk River, Minnesota,
All
which
right.
is like right on the cusp of rural, which was very exciting.
What is Elk River like?
Oh, Elk River, now it's really become a much bigger, but it used to be where like all the farmers lived, which was really exciting because it really allowed you to do true full spectrum family medicine care versus a lot of family medicine now is, managing referrals to other specialties versus
Is it so
managing the
small that you
patients.
actually kind of know your patients?
Yes.
You know, like they're not setting an appointment. And it's not a stranger walking in.
No, they know it is me. They are bringing me, my favorite rosette cookies at Christmas. Like they know me intimately.
Right.
Okay, not intimately. They know me very well though. And so
Yeah.
so it was very hard to leave that. But I had a friend who was working at Target, also headquartered in Minnesota.
Oh, wow.
And they had decided they wanted to get into the retail clinic game. And so they said,
Target.
yeah, the Target boutique. They wanted to start doing that, and they needed some help from clinicals experts to support that. So asked if I would, come on board there, and I did, and I saw patients actually in a Target store for 2 years, while also running that little clinic, but then also supporting our headquarters partners and kind of figuring it out and forging the pathway forward.
And so that had to be like baptism by fire, because you're going from I'm picturing, and if I'm wrong, correct me, but I'm picturing, a quaint town with primarily, rural folks, farmers as patients. You know them on a first name basis, and bam, you're in Target. You're in the middle of like Grand Central Station, USA.
Yeah.
And what did you walk in and like say, after you were at it for a while, like, what did I sign up for?
Yeah. You know what? The interesting thing about it is that, it wasn't actually as hard of a transition as you might think, because it turns out people go to Target more often than they go to their doctor's office. So, you're still seeing, mom is bringing in Susie for her sore throat on Tuesday. By Friday, Timmy has it. And then on Saturday, she's the treat mom for soccer. So she's back in to pick up, oranges and, water. So you're seeing these people very regularly, not always for their clinical care, but they're still walking by the clinic and giving you a wave and popping in for a hello. So you still were able to establish really meaningful relationships with people, even though you weren't their primary provider, which is great.
So that's pretty cool. Like, I could tell you firsthand, you won't find that in Queens. You're not going to get that warm, fuzzy. It's if you do, consider yourself lucky.
Okay.
And I think, I never blame the docs when I talk about the broken healthcare system. The docs are not the ones to blame, particularly in, these metro areas where it's so packed and so condensed. I mean, Queens is one of the most populous and the most diverse borough in the country. We've got people from all walks of life. Every language imaginable is spoken in Queens. And so there's something beautiful about that, in my opinion, but there's also... it's very hard to relate when there's that much diversity. And just in terms of, particularly knowing a patient's name when they walk through the door. I mean, good luck with that when you have a city of 12 plus million people, or however many we have.
I am certain, yes.
Right? So it's crazy. But I think a lot of the docs are just completely burnt out operating in the status quo healthcare system. If they're affiliated with one of the big hospitals, and I would say that represents the vast majority of practicing physicians, they are really kind of under a tremendous amount of pressure. They're under the microscope. Their performance is being demanded from their higher ups, and folks don't realize it. Like, I think for the most part, myself included, we put our doctors on a pedestal, and I think that's earned, that's deserved, right? But at the end of the day, the physician that we're seeing, our direct primary care physician or specialist, they're not calling the shots anymore. Once upon a time they
Right.
were.
Right.
They're not calling the shots anymore. And now they're being treated as glorified salespeople. They have these relative value units that are credits that they earn when they refer people to the health system that they're affiliated with for an MRI or a CAT scan or this or that. Most people aren't aware of that.
Yep.
And so, when you think to yourself, hey, I went to the doctor, you hear my voice. I shared with you that I have like some crazy allergies going on, but you have a little tickle in your voice, let's say, and you go to the doctor, and the next thing you know, he's signing you up for an MRI and a CAT scan and a this and a that. And you're like, Jesus, I just walked in here with a little scratch in my throat. What's going on? That may be because the doc is legitimately concerned and looking out for your best interest, and let's hope so. But it may be because that doc is under a tremendous amount of pressure to perform and make money for the family.
True. But another piece that I always think about, though, is when some of that testing is ordered, it's also the part of now we have to have that CYA insurance, right? We've become such a litigious society that even though, it's less than a fraction of percent that your tickle might be something really severe.
Right.
Now we have to work it up because either the patient has set that expectation because they saw a commercial on TV that told them they should be thinking that's what it is, or the doctor has that, that devil on your shoulder going, oh, but what if it is that? And now you're going to be facing a lawsuit and, all the hard work and money that's come with it leaves.
Yeah.
It's just a complicated system that
It's crazy that we've become so litigious,
Yeah.
right? It's sue everybody. And at the end of the day, that's just no way to be. And that certainly has its place in, creating this behemoth that the healthcare system has become, right?
Absolutely. Yeah.
So, but at what point is it not a best practice to order these tests, right? Because I think that's the
Right.
other side of it. The one side of it is, okay, you do want to cover your ass and make sure that you're not going to get sued for missing something. But then, do I order a major diagnostic test at the hospital, which is an $8,000 test because this kid had the sniffles and I saw him once? Or do you maybe schedule a follow-up visit and do some other
Right.
tests before then? And I think that's where the problem is.
Absolutely. And then the complicating part of that too, though, is like meeting the patient's expectations because you're also charged with like the triple or now we're, I think, the quintuple aim, right? So we also are getting reimbursed and getting quality benefits based on how satisfied the patient is. And the patient isn't always satisfied with coming back because it's another day off work, it's childcare to find, it's all those other complications. And I'm not saying that there's a right or wrong answer there. I'm just saying it is that. It's very complicated to try to figure out what the right path forward is when these physicians face all of these pressures to perform on various metrics.
No question.
At the end of the day, it definitely impacts care delivery for sure.
Yeah, well, and when you look at the premiums, the insurance premiums, right? Because at the end of the day, healthcare has nothing to do with insurance. Healthcare is really between a patient and their physician at the end of the day.
Ideally, yes.
We could talk about it in an office setting. We could talk about it in a hospital setting, at a clinic, wherever it may be. But that is kind of the relationship. It's, I have a problem. I need to speak to a professional, a doc, a nurse, what have you, a medical professional to discuss my problem. And hopefully I'm going to lean on them for their wisdom and their counsel and their hands and their knowledge, and they're going to guide me in the right direction. They're going to put me on the right path, and I'm going to feel better, right? That's really what it's all about. But we have this little thing called insurance, and insurance is now the cost of a new Mercedes every year, right? So,
Just about, yeah.
So at the end of the day, like people are out there and they're looking at, and this is a good time of year, so we're recording this in early December. Most people that work for businesses, which is how more than half of Americans get their insurance coverage, have either gone through or are in the midst of open enrollment, making their elections for their coverage next year. And for the most part, they're only seeing their cost of the expense. How much is the premium going to cost me per week, per paycheck, twice a month, monthly, et cetera? And they're not seeing the big picture. But the truth of the matter is, on average, if we blend employee-only coverage to family coverage, and there are tiers in between, it's approximately $17,000 per employee per year. Family coverage on average in New York City is pretty much north of $40,000 per year.
Yep.
That's a lot of money.
That is a lot of money.
That's a lot of money. And so that's where River Health comes in. And so River Health is the organization that you're now affiliated with. Give us your title.
Yes, I am the Vice President of Clinical Operations. Yes.
Vice President of Clinical.
Yes.
That sounds important.
Yeah, when I got
You
that
must
job,
be important.
Yeah, I don't know how important I am, but I did make my husband call me Madam Vice President for a full week. Just
As
to
well
enjoy
you
it.
should.
Yes.
Excellent. And so tell us a little bit about River Health, because what I love about this is it is not a status quo health plan. And I think if we're going to fix healthcare, we have to start thinking differently, and we have to do things differently. And so I'm sure that was part of the attraction to you for making this move. I don't know if you went in a straight line from Target to River or not, but I'm sure that was what attracted you to the position. But you tell me, what is River Health, and what should people know about this as a healthcare option?
Yeah. So I think you've really called it out, Ray, when talking about the employer component, right? Because so many people do get their health insurance, through that employer relationship. But because of that, we've really developed a class system for insurance coverage in the country, right? And so for folks who are maybe independently employed, or they're seasonal or hourly, they don't have the opportunity to get into those same avenues for coverage for, individual and family plans in the same way a full-time employed salaried worker is. And that's really where River Health comes in, is it's a health plan for hourly workers, not exclusively hourly workers, but that's the mainstay of our members. And it's really meant to be a plan that offers them care for the greatest needs that individuals face in their health plans. So it's an opportunity for folks to get, that unlimited virtual primary care. So when they do get asked to come back a week later to evaluate that sore throat or that sniffle, they're not as upset about it. But it covers, basic labs, 7,000 different formulary medications. It gives them a mental health benefit because we know the country is struggling right now. So they get unlimited teletherapy to support mental health, along with a subscription to Calm in order to augment that teletherapy, and really designed to meet essentially 90 to 95% of the care needs that an individual is going to face in a year. But at a price point that isn't a base model Mercedes, so that they can get that care. And that they're able to, access it on the terms where, there isn't necessarily this open enrollment piece. They can enroll when they need that coverage. And it's a monthly subscription. So they pay their $50, per month in order to be a member and get really all of that care. And I think there are two things that really attracted me to this, to answer the other part of your question. Being a child in the food and beverage industry, of a dad who worked at a bar, right? Insurance wasn't something that was available to us because we were independently employed, family.
Right.
And so, we had to make, choices about access to care and coverage growing up that were certainly difficult for a small family-owned business. And so being able to be a part of an organization that improves that access to care and makes it easier for folks who fall into that category to be able to receive care was certainly very, very attractive. And it allows us to do a lot of good for a lot of people, and being able to get that care. Because unfortunately, that $17,000 bears out from the fact that we know that 5% of the population, causes more than 55% of the healthcare costs in the country, which for that 5%, of course, they're getting the care they need. But it also means people like you and I are just seeing our premiums ratchet up and up every year,
Right.
making it more difficult.
Yeah, and that's what's crazy about the system, right? You have, what you're talking about is really just kind of the breakdown of the way that claims are distributed. It's a kind of a law of mathematics, right? And so 5% of the population driving 50 to 60% of claims really, and your top, 1%ers driving a third of your claims is pretty crazy.
Yep.
And yet, because of that scenario, that risk is kind of spread amongst the whole pool.
Right.
So whether you're sick or well, young or old, you're kind of paying your fair share, or maybe not your fair share, but
Right.
you're shouldering that burden, I think is a better way to put it.
Absolutely.
And that is a problem that's inherent, in the system. And I wish I had a good answer for it. I don't. I don't think anybody does.
They don't.
And nothing so far has worked, right? But I can appreciate that, growing up in the environment that you did, you're attracted to this model because you see the benefit of it, right?
Absolutely.
If you're in that scenario, and many, of our family and friends and our fellow Americans are in that scenario, you're kind of in between a rock and a hard place. What do you do? If you're just making ends meet, you're an hourly employee, you're not entitled to benefits, but you're not exactly at the poverty level, where does that leave you? You're kind of in no man's land. You're in limbo, right? But if you need access to healthcare, you need access to healthcare. So what do? Do you just go with nothing? Well, that's never a good idea. And so what I love about the solution is it's super affordable, and it gives people access to care. So the question, though, that I think would be on everybody's mind is, well, that's got to be a garbage plan, right? if we're looking at, kind of what the layman would think, well, what are you going to get for $50? You only get what you pay for, and blah blah blah. And that's not always true. And I think in the case of River Health, and I'm not getting on a tree stump selling for you here, but I think sometimes you do get a disproportionate value for your dollar. And every once in a while, along comes a solution that actually is fitting a very needed niche. And I think that's where you fall. But, what would you say to someone kind of looking at this saying, well, I can't afford health insurance.
Yep.
I can't afford a new Mercedes every year.
Yep.
Right.
Absolutely.
I just can't do it. So I want to have something as opposed to nothing. But how would you describe this to them in terms of where it kind of, what gap it fills, and what would happen in the case of a worst case scenario? I'm sure you get this question all the time.
I sure do. So I think River Health actually is a super high value plan. And when I think about my time in family medicine, and I think about the care that I was giving most often to people, right? Standard labs with, cholesterol and diabetes screening, right? Or complete blood counts, or, getting standard x-rays to make sure that sniffle isn't pneumonia, well woman exams, we're doing prescriptions for birth control or antidepressants, right? It truly is like that 90% of care you're getting in primary care. You actually can get that really affordably if we cut out a lot of the different middlemen of healthcare, right? And so that's a big...
Wait, there are middlemen? What?
I know. Again, people have that intimate relationship with their doctor. They don't always realize it, but yeah, there absolutely are. And so when we can do just direct care for patients, and we're able to truly negotiate on their behalf to get great rates for imaging, for prescriptions, for lab testing, we're able to give you a really robust plan that really is going to meet the majority of your healthcare needs. So I can see where you get what you pay for comes into the conversation, but you missed the part that when you're paying your $40,000, you're not getting a lot of what you pay for. And with River Health, you're getting exactly what you pay for in the services, and there's no surprises that something was in network or not in network, or covered or not covered. It's incredibly transparent around what you're getting and what is included for your per member per month fee. Now, I certainly don't want to pretend that we're the be all healthcare of plan choices, right? For example, you're growing your family. We don't offer maternity coverage, right? So then we probably aren't the right plan for you. Or to your point about the what if scenarios, you definitely don't want to be like eternally bankrupt because you fell off the ladder putting up your Christmas lights and hurt yourself. So we think it's important also for folks to look at being able to add on an additional catastrophic plan, for example, where low cost to the individual per month for those low likelihood of events that could happen,
Sure.
but at least you've got that additional safety net. But even when combining the cost of that River Health plan with that catastrophic plan, it's still not hitting those individual and family plan numbers
Right.
that we were talking about earlier.
Yeah, no, I think that's an excellent point. That's really a great way to put it. I don't know if anyone, I haven't heard anyone else put it quite that way, but think of, how much of that $40,000 you're not getting value for, and it's most of it.
Yeah.
For the most part, right? And if you are getting $40,000 worth of care, then you had a pretty bad year,
Yeah.
right? But that is, really insightful, I think, to, honestly, to think about it that way. Episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket cost for healthcare. Visit benefixa.com today. And if truly what you're saying is right, 90+% of your care is being addressed by River Health as this alternative, and you can cover yourself with a catastrophic plan, you've really solved a big problem, right? Because again, most people, I think, when they think about their health insurance or their medical coverage, they tend to think of it as good insurance and crappy insurance, kind of like I said earlier.
Yep.
And the reality is, insurance is really just the transfer of risk.
Mm-hmm.
It's a letter on a piece of paper that says, here's what we're responsible for, and here's where our responsibility ends. Most folks don't have a good handle on what that insurance contract is.
Right.
And I've been in the game for longer than I care to say, like a long time now, over 20 years. And as a quote unquote expert, I have to read the fine print. I have to scrutinize a contract and really kind of digest it and say, well, and what's the most important language in any insurance contract? What is not covered is the most important language in any insurance contract. And so it takes me a minute to go through and mull this over. But when I look at something like River Health and I say, well, if they're addressing 90% of the issue, and then you can supplement with a catastrophic policy that costs a fraction of what, a typical POS plan would cost. Doesn't that just really make sense? Because ultimately, I think there are more and more high-deductible health plans out there than ever. With these
66% of Americans, yep.
66% of Americans. Thank you for that stat. With this HSA attached, and people are like, oh, the HSA. And it's like, well, think about it. First of all, the HSA wasn't the concoction of, Farmer Joe. It was the concoction of an insurance carrier.
Yep.
And they crafted the HSA because they basically looked at it as a marketing ploy. If we can jack our rates and pay out less coverage and incentivize people to invest in this savings account, and they buy it, this would be a win for our insurance company. It would be a win for all insurance carriers. And what a win it's been. It's amazing. But what most people don't realize is, what if that's your money?
Right.
What if you took that money and invested it elsewhere? What if you did that? And, you know, think about investing over the course of 10 or 15, 20 years, a lifetime. How much money are you going to have in your HSA? And let's dream a minute and say that you have $100,000 in your HSA account. It only takes one accident to wipe that out.
Yep.
Poof, gone. And there are your savings. And so I look at an HSA and it really is, it's and look, I have clients that have high deductible health plans with HSAs. And I'm not here to tell you that they're the root of all evil and the devil. They're not. There is a purpose. It has its place. But if you ask me if that is the move to have a high deductible health plan with an HSA attached, the answer is no. And most high deductible health plans require the member, the employee or their family member, if we're talking about the group market, which is where I focus, to come out of pocket thousands of dollars before one iota of care is delivered, with the exception of maybe preventive wellness, that sort of thing, right?
Yep. It's north of $1,700 a year for the average deductible right now.
And do you happen to know what people have saved for a rainy day on average?
Right. Less than $500, right, is what folks have.
Less than $500. Yeah. So how does that math work?
It does not for the you and me, the average healthcare consumer.
So we have a term for that. It's called functionally uninsured, right? You have a health insurance policy,
Yep.
but it's unaffordable.
Yep.
And therefore you can't access healthcare because you can't afford your share of the cost.
Right. And that's true for 1 in 4 Americans who are on an HSA plan. And the hard part is it actually in the long term, right, ends up costing so much more because that sore throat that could have been handled relatively easily with a visit to your PCP or your urgent care, you don't go in, right?
Right.
And now we wait, and then now we have a terrible case of tonsillitis, and we end up in the ER. So it only costs us more to treat what could have been treated very cost effectively, but we didn't have the cost to pay the entrance fee to use our deductible for the insurance that we're also paying for.
Fantastico.
Yeah, yeah, it's terrible, and it's
not
certainly a
it's-
disservice to the patient.
It's not the way it's meant to be.
Yeah.
Right? It's, if you think about it, this model has only been around for a short while. If we look at human history and, evolution and stuff, right? This model is really a nanosecond of a nanosecond.
Yep.
And it's broken.
Yep.
And so the River Health model, I think, is a phenomenal solve. Talk to me about employers. You mentioned Target. Like an organization like that has, I would imagine, a pretty healthy force of hourly workers. And certainly many, many, many much smaller companies
Yep.
have a force of hourly workers that an employer would, in good conscience, like to help. They'd like to do something for them.
Yeah.
But they can't afford to spend, $600-800 a month for
Yep.
a policy when an employer's wages are, just not much more than that.
Right, exactly. We are fortunate to have really great client employer partners that we work with. Some of them, we work with companies like Kohl's or Cracker Barrel or Taco Bell or Raising Cane's are these groups that have, large swaths of hourly employees. And the great part of being in partnership with River Health is that they can really still make an impact on the healthcare for those employees in a way that financially makes sense. So some of our employers cover all of that $50 per member per month cost. Some of them cost share, right? And they pay part and then the employee pays part. But either way, it's a great opportunity for them to support the health and well-being of their employees. And I'm not going to pretend that there aren't benefits to them too, right? The Society for Human Resources says it costs somewhere around $3,600 to replace a single hourly employee. And when you think about that, anything that you can do to help attract and retain talent is huge. And so these employers who are partnering with us at River Health are able to offer their hourly employees access to a benefit that their competitors don't otherwise have or offer. And it's great for improving that retention, that turnover. but also even things like their ability to come to work, right? If they're able to access care quickly and affordably, it's less missed shifts, it's less impact to these employers' shoppers. It's less burden for the coworkers, employees who inevitably have to bear the weight when somebody calls out for a shift at the coffee shop. So
Yeah.
it's a real win for the employer and the employee alike to be able to offer these types of healthcare benefits.
Yeah. I would imagine a lot of these organizations were probably delighted when they learned of your service, because I don't think there's a ton of competition in your space. I think there are many employers with hourly employees that, just don't know what to do with this. It's a problem, right? Because people need healthcare, whether you're hourly or salary. We're all people. We all, we all live and breathe.
Exactly. And they are also facing the part of it being a talent war out there, right? If you can't offer what this employee needs, I don't know the last time you were out to a mall, Ray, but they all have help wanted signs. Everybody is hurting for talent in the retail, hourly worker, food and beverage space. And so
it's so funny. I used to live in a mall when I was a teenager, right? It's like, what do you do? There were no cell phones back then. It was like,
right, you meet your friends at the mall. You
go
share
to
a
the
cheese
movie,
fry.
go to the mall. Yeah, go cause some trouble. It's been a minute since I've been to the mall.
Hey, fair enough. Home delivery systems,
Yeah.
really a lot of us have reduced our time. But
Yeah.
we are in the holiday season, and a lot of people,
Yeah,
are
maybe
out there
maybe I'll go
looking
out
for
to a
that
mall.
help.
Yeah. I have a little bit of nostalgia in my. There's a little soft spot in my heart for the mall.
Yeah, I'm told that they're making a resurgence.
Really?
Actually, yes.
Huh.
People are craving the ability to tangibly touch products. Having a little bit more supportive, also small business, all of the things. So yeah, there's a resurgence in the mall department.
Back in the day, I used to carry a comb in my back pocket then.
I believe it.
Anyway, so I still have questions. Do you have like a net promoter score? You know what that is?
Yes, I do.
And
yes.
how are your numbers? I should know this question before I ask it. Bad host.
That's okay.
How are your numbers?
We do, because we care. So we actually measure Net Promoter two ways. We measure it both from the employer and how they're feeling about our relationship, the benefits they're getting, and then we also do it from the member who is the subscriber to River Health on how they're feeling about the actual care they're getting.
How do people feel?
Ability to get prescriptions. Good. Our Net Promoter score for both is consistently over 90%.
Wow.
For both parties.
That's super high.
Yeah.
Phenomenal. And so what is, what can a patient expect? If someone out there is listening to this and they're like, I'm going to bring this to HR because we need to get River Health at our place. So now, they tune in, they hear this talk, they love you, they love what you have to say, and you got them all excited. And they're like, let's do it. Now they're on board as a member.
Yep.
What does the onboarding experience look like, and what would they expect when they go to access care?
Yeah. So we know that we're a unique offering. So we have a whole host of tutorials to help folks navigate this, right? And so depending on what type of learning you are, we've got FAQs, we've got videos that demo how to use the service, all of those things. But really, at the heart of it is there's a River Health app. You go online, you log in, and from there you can do all of the things that you need to for your care. It's really trying to make care available at the click of a button. So you can do the kind of the bread and butter of our business, which is see a doc online. So you fill out your virtual health questionnaire, right? What are you here for? Is it a sore throat? Do you need a refill of your prescriptions? Do you want to start contraception or need lab testing? You fill out your intake questionnaire, and then one of our physicians or nurse practitioners from across the country will connect with you, whether that's asynchronously via chat or via phone or video, depending on the patient's preference, but also based on what they've put in their information for their screener. And then the provider is going to provide that care, whether that's getting them a prescription, sending them for imaging if it's appropriate, sending them for lab work. But then accessing all of those benefits I just mentioned are also right in the app. So they have a virtual wallet, which has their virtual prescription card, so they can go to, any retail pharmacy across the country. They can get mail order.
You have an app on
with
here?
Amazon Pharmacy.
They can access it from their phone?
Yep, right from their phone.
Wow.
Get that virtual prescription card. They have a virtual lab card that allows them to go to any Quest location across the country to access those formulary labs to get that testing done. We have a partnership with Green Imaging. They're able to go to any of those locations again across the country for their screening mammograms, their x-rays. But
are there additional fees for that stuff?
So for screening mammograms and x-rays, that's included within their River Health membership.
Okay.
If they end up needing additional imaging, those CTs, those MRIs that we talked about earlier, those are available at a discounted price, but they would be cost sharing for those additional services.
Got it. And how about the blood work?
Yeah, that they go to the Quest lab, they bring their lab order, whether that's a lab order from our River Health team or their primary care provider that they see. And then they've got that virtual lab card. The lab tech rings it in. They pay nothing out of pocket, and they get those labs.
Wow.
And the great part, too, is, at River Health, we recognize that not all care can be delivered virtually, right? Inevitably, you're going to need maybe stitches after cutting that Thanksgiving turkey, or, of course, getting
that bullet.
Yeah, getting a pap smear, whatever that looks like. The plans also include 3 in-person care visits to your primary care or to an urgent care provider over the course of your year, to make sure that for those times when doing it online doesn't work, that you have access to that. And you have a card, again, in that virtual wallet that makes sure that you don't pay out of pocket when you go to that urgent care, your primary care. You just use that virtual MasterCard. I get the bill, you get the care, and the member goes on their way. So,
yeah. Such a deal.
So it's like so many things today. There's an app for that. You go onto your River Health app and access all of that care.
So I'm hearing you don't have brick and mortar then anywhere.
No, but at the same time, we have brick and mortar everywhere because we allow our members to have a fully open network, which means if you're traveling, or you just have a preferred provider that you've seen all of your life, or, maybe here in New York, maybe it's a public transportation piece, right? You need to find a doctor that's actually on the bus route or on the subway route or has hours early in the day or late in the day. We put that completely in the patient's decision to pick that provider, and we'll cover those 3 visits over the course of the year. Got it.
Very cool. So, trying to poke holes in your model. Because that's what I have to do for the audience.
Absolutely.
So I slip on a greasy floor on Thanksgiving.
Yep.
Didn't clean up after myself. My knee slams into the ground. I need to go see an orthopedic surgeon for a consult. What happens with that? Do you help in any way, or is the patient on their own in that scenario?
Yeah, so if you end up needing care that is outside of that bucket, we do help to support them. We have a great referral coordinator that helps to identify the partners that are available to them or where they'd like to go based on their personal preferences. While they will be paying for that cost, they help them to find those lowest cost alternatives to receive that care. But orthopedic surgery is not a covered benefit.
I didn't think it was. Not at $50 per month.
Not at $50 per month.
But but the reality is, again, if folks are new to the podcast or haven't, been listening, typically the cash price for any procedure is always going to be less costly than the contractually negotiated rate with the insurance carrier. And that's counterintuitive, but it's just kind of the way that it is. And with these procedures,
you could save up to 500% of the actual cost.
If not more. Yeah. I've heard 10x stories.
Entirely possible.
So, and if you think about it, if you're in a traditional high-deductible health plan that has, it's not uncommon, a $5,000 deductible, I'm not saying you're going to get knee replacement surgery for $5,000, right? But I do think that that's where your other recommendation comes in, and you're telling us that most of your members have some type of a catastrophic plan backing them up. That's where that policy would come in, and if you're negotiating a cash price and you have that combined with a catastrophic plan, you're probably often in much better shape than if you're in that standalone plan, because again, In that standalone plan, let's not forget that you're paying $17,000 on average, for coverage. If you're an individual, let's say you're paying in the $10,000 range. If you're a family coverage on the other end of the spectrum, you're spending north of $30,000 typically. So you can get a catastrophic plan at typically a fraction of that. And if you have River Health as kind of your front end to access care, because and that's one of the problems, right, with healthcare. We have these policies that cost these fortunes, and 99% of your needs are not the part that costs the fortune.
Correct.
It's just the day-to-day stuff, right?
Yep.
So, if just kind of drawing this analogy up, pulling it out of the air, but if you could go to your local market and get your eggs and your milk and your coffee and your this and your that, and you could access that at a fraction of the price than if you went down the road to where you get your once in a year turkey, and the milk and the eggs and everything else cost 10x what the place down the street does because they don't have the turkey. What are you gonna do? You're gonna go to Target for your milk and your eggs and your stuff, right?
Yeah.
It's crazy that that's what we're living with, right? Because we kind of pointed out two pieces of this. One is you have, no offense to anyone, but you have the Walking Dead that are driving premiums up for everyone.
Yeah.
And we're all paying for that. And then, you have this access to care issue because when you're in a high deductible health plan and you can't afford your share of the out-of-pocket, you're functionally uninsured anyway.
Yeah, I actually just heard a really good analogy on this, right? It's like you have your Netflix subscription. And how crazy would it be then if when you actually watched that sappy Hallmark movie, then Netflix charges you for watching the movie, and then 6 months later you found out that one of those actors wasn't actually contracted with Netflix, so you have to pay more for that out-of-pocket actor that was on the show, and you're like, wow, yeah, we wouldn't tolerate that from other services, yet it's so commonplace that we pay all this money for the insurance that we then can't use, and if we do, it's even more expensive, and it's
it's a really
crazy.
Tough spot. All right, talk to me about drugs.
Haven't been asked that one in a while.
Are drugs covered?
Yes, so we have 7,000 formulary prescriptions that are covered on our plan, and it's robust, right? Because it's meant to be that primary care offering. So even, some of the most complicated cases within diabetes, right? We cover 7 different, we cover several medications from each of the 7 different types of insulin that are available out there. All of your blood pressure meds, all of your cholesterol medications, the swath of antibiotics for all of the different minor illnesses and injuries you're going to get, right? Contraceptives. I certainly can't name all 7,000 of them, but it really does meet the needs for just about anything that's going to be in your average medicine cabinet for the needs of folks.
Right. So it would probably be a good practice if you have folks that know that they're on maintenance medication to, just check and see if their medication is covered, it's on your formulary.
Yep.
And then if it's not, get an understanding for what it would cost to get that medication.
Absolutely.
And pay for it cash out of pocket or find some other type of discount pharmacy card. I know that, in my case, I've had gout since my early 30s. It's hereditary. And so I'm on febuxostat. Uloric is the formulary name. And it lowers my uric acid. And if I go through my wife's health plan, it's $200 for a 90-day supply. And I could go on GoodRx and find the same exact medication for like $35, which is insane.
Totally insane.
So we have this $40,000 policy, and it's costing me like, 6x to get my medication through that Mercedes-Benz policy than, direct cash pay basically, which is insane.
It is totally insane.
But folks should know that that's not always going to be the case.
True.
And that, they have to kind of consider all things when they jump on board. But let's face it, the majority of folks that are your target client, they don't have a choice.
True.
They just don't have a choice. The choice is, do I do nothing?
Right.
Or do I have River Health, which is got to be a godsend for so many of your people, which I think is why your Net Promoter Score is probably so high.
It. I say it all the time. Like a month does not go by when I don't see the word love in our Net Promoter Score, which just blows me away because I never hear people use the word love to talk about, insurance or healthcare typically. So it certainly is really meaningful for me and the rest of the team at River Health that patients have responded so positively to the offering. And I think you're absolutely right, when when employers are thinking about whether or not they want to, bring on River Health, the question is not, is this the same as the gold plan that I'm offering my salaried workers? It's no, the difference is, are you offering something or nothing?
Right.
And so they really do think about that. And just to follow up on your gout medication, we want to be really transparent with our members. So right on our website, you'll see our full searchable formulary for all of your medications. You'll also see the full searchable laboratory compendium. So you can also see what exactly is available to you included at that monthly cost.
So you have transparency, which is great.
Yeah.
That's super important. So who started this mess? Who said to themselves, I got it. I know what I'm going to do. I'm going to offer healthcare for $50 a month.
Yeah, I would genuinely love to be the person taking credit for this because it makes my heart so happy to see the people who are helped. But our CEO, Kobe Amoa, he actually used to work in the financial industry and had access to a lot of claims information and data, and had the aha moment that I think we talked about earlier, which is, wow, the cost to actually just deliver like your typical needed care is really not that expensive compared to what we charge people based on the claims of this very small subset of people.
Right.
So what if we were able to, improve access to care by making it easy to understand and affordable? And it doesn't necessarily have all of the bells and whistles of those other plans, but it's going to get you what you need to get and stay healthy. And I certainly don't know his full story, but had a moment of brilliance. He has many of them, but that's the one that turned into River Health. And we've been fortunate to have some wonderful investors who agree with him that this is a unique way to get more people on the path to better health. And
very cool. What's the BHAG? What's the big, hairy, audacious goal of River Health? What's the vision? For how long have you been around?
The organization started in 2020.
Ground zero.
Yeah, exactly. Just trying to
the
find
date
a way
that shall not be named.
Exactly. Looking to get folks, access to care. But I would say, and that's when we, the founders were, coding in their mother's basement, for lack of the better word, right? To get things off the ground. So founded in 2020, but I'd say probably 2022 being the real jumping off
launch
point
year
for serving patients.
And so is there a big overarching goal in terms of what the vision and the mission is? Like how big do you think the scale for something like this could be?
I mean, when we look at the number of folks, across the country who are hourly, seasonal, fractional workers, or you're 26 and you've just gotten dropped off your parents' plan and you're not in those, categories anyway, but need some level of coverage. I mean, you're talking about, really millions of people. And while we've got a way to go to get there, our goal has been from the start to be the best health plan for hourly workers across the country. And our goal is to keep going until more and more people have, access to care that helps them get and stay healthy.
Love it.
Yeah.
I really love it. I mean, you use the word, I'm going to use it now. I love it. You're really filling a void. There's a huge need for this.
Yeah.
And so it's just, kind of that, what would concern me is if, you weren't transparent and this, that, and the other thing is kind of hidden and buried, but you're putting your formulary out there for everyone to see, and it's really up to them. Of course, it's buyer beware. You have to know what you're getting.
Right.
You're not saying this is a replacement for your, United Healthcare, your Blue Cross, or your Aetna, or this or that or the other thing. it's an alternative
Right.
that can really work well for folks that just can't afford the other stuff.
Absolutely. We have folks on our plan who actually have a traditional insurance plan, but because they have that $1,700 deductible, it's easier and more cost effective for them to pay the $600 to River Health at that $50 per member per month and access their meds, labs, imaging, in-person care, all of their virtual visits through us than it would be to try to chip away at that $1,700 deductible. So there's the goal is just getting more folks getting care.
Really cool. And so do you have is it $50 a month whether you're an individual or whether you have 20,000 employees? Are there deals at scale if the employer is paying? I would imagine there is, but I don't know.
Yeah. So, I mean, transparently, yes. You know, so for some of our larger employers, yes, at scale, they do get an additional discount for sure.
Yeah.
And when I'm saying $50 per member per month, that's absolutely the most an individual would be paying. We have lots of really wonderful employers that, you know, cover a portion of that cost, you know, bringing it down to, you know, $10 to $20 to $30 a month in that kind of cost share model.
I'm sure you have employers that are covering it all.
Yeah. So it really depends on the employer in that case. But yeah, $50 a month is the worst case scenario for our members.
Right. Yeah. Wow. Very cool. And so how do people find you?
Yeah. Well, they can certainly come to our website, river.health, and take a look at all of our info. They can find me on LinkedIn, of course, if they want to connect directly with me. But we are on all of the socials. So whether you're, you know, Instagramming, TikToking, Facebooking, all of those things, you can find River Health in all of those spots as well.
So you're going to have millions of people searching for Lexie Leitner on LinkedIn.
I hope that they do. I am born out of the bar business. I'm a people connector, so I love to do it. So I hope that they will.
That is awesome. Is there anything that you wanted to cover that we didn't, that we missed?
No, Ray, I think you're a delightful host and you've hit on all the things we wanted to talk about. You know, healthcare has these different players that are making it hard and River Health is here to try to make it easy. And I think we've done it.
Right on. Yeah, no, love it. I think it's needed. It's high time that, you know, there is an affordable alternative to traditional healthcare. And man, you know, covering 90% of people's needs for $50 a month, worst case scenario, is going to be pretty hard to beat that deal. So
I sure think so.
There you have it, folks. Until next time, love always fits right into the theme. Take care. Bye.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.